American adults are reportedly drinking more alcohol during the pandemic. This is according to the American Medical Association. Alcohol consumption rose 14% between 2019 and 2020. Eyewitness News reporter Zach Briggs spoke with local health experts about what's prompting this over-reliance on booze.
Isolation, depression, anxiety, all of those are a perfect storm for somebody consuming more alcohol.
Abigail Moore heads the San Antonio Council on Alcohol and Drug Awareness, or SACADA. She says the coronavirus pandemic has led to an increase of reports involving alcohol abuse impacting people of all ages.
We are getting reports from parents of underage drinking, binge drinking by young people, and definitely binge drinking by older adults and adults who are either working from home, not working at all, or just struggling with the challenges that mentally have been developed due to the COVID pandemic.
WellMed's Dr. Chris Arnold works with dozens of older adults who felt isolated from family during the pandemic. As a result, they've turned to the bottle more often.
And that can be very, very depressing for these older adults who are so connected.
Arnold realizes checking up with friends or loved ones about their potentially destructive drinking habits can be difficult. Alcoholism carries a certain stigma.
And it can be a sensitive subject when you start addressing, hey, how much are you drinking? Okay, so how big are those glasses? And tell me, what kind of whiskey are you drinking? So when you start asking those kind of questions, people get defensive.
Moore believes the cycle of alcoholism will continue to be problematic as more people receive the vaccine and feel emboldened to venture out into the community.
Our concern is drinking and driving will go up, other fatalities, assaults, other things that go along with heavy consumption of alcohol.
Whether it's through WellMed, SACADA, or another organization, Arnold and Moore reminding the public there are avenues for help. Zach Briggs, KENS 5, Eyewitness News.